Hello, my name is Mary Whitcomb, and I'm the director of the Broome County Office for Aging. This educational training video will provide you with information on the Consumer-Directed Personal Assistance Program, also known as CDPA. The video will explain the value of the Consumer-Directed Program and how it can assist you in providing care for yourself, a loved one, a family member, or another person needing care. CDPA is an alternative to traditional home care and allows individuals to hire and direct their own personal assistance workers. The worker can be a family member, a neighbor, a caregiver, a friend who is hired to assist the individual with activities of daily living, such as bathing and dressing, cooking, eating, and other household tasks.
Here are some guidelines around eligibility for the Consumer-Directed Program. Medicare does not pay for consumer-directed care. You must be Medicaid income eligible and approved by DSS or a managed care company. Individuals 60 and over who are income eligible may qualify for grant funding through the Office for Aging.
At the Broome County Office for Aging, we often get questions regarding the CDPA program. Here's one of them. I really want to take care of my mom, but I would have to take time off of work to do so. Are there any programs that can help me and my mom? Yes, your mom may qualify to use the Consumer-Directed Personal Assistance Program, where she can hire you or a caregiver to assist her. Another question we often hear is similar to this. While I appreciate the help from my aid agency, I really wish I had more control over my care. Is there a program where I can make decisions on who my worker will be? Yes, the Consumer-Directed Program does just that. It allows people who need care in the home to direct their own care. They can recruit, interview, train, hire, supervise, and fire their worker as they see fit. You can hire one worker to meet all your needs, or multiple people. The amount of hours provided is determined by the payer source for your care. Older adults are not the only people that can utilize consumer-directed care. It is also utilized for people with many different types of disabilities and needs. We often get questions about people that have other needs. I recently was involved in a car accident and have multiple long-term injuries. I'm 40 years old and I can use some help with dressing and bathing. Can I receive help through the Consumer-Directed Program? You may qualify to use Consumer-Directed Personal Assistance, where you can hire someone to help you with your dressing and bathing. We also hear from people that are non-family members, such as neighbors, and we have received questions such as this. My neighbor in my building said she has been waiting for an aide for a long time. I have some free time a few nights a week. Can I help? It is possible to hire a neighbor to be a worker in the Consumer-Directed Program if they register through the fiscal intermediary. There are times that Office for Aging receives calls from older adults who are the caretaker for people in their homes that have additional needs. We have gotten questions such as this. I am a senior who is raising my grandson who has cerebral palsy. I require someone to help me with his care. Can I get help? Yes. You may be able to hire someone through the Consumer-Directed Program to help with some of your grandson's care, and it can help provide you with some respite for yourself. If you have questions regarding consumer-directed care, you can contact Near Connects at 607-778-2278 or contact Broome County Office for Aging at 607-778-2411. And they can review the Consumer-Directed Program with you and other services you may be interested in. The Consumer-Directed Program provides choices to empower seniors and people with disabilities to manage their own care. Consumer-Directed Personal Assistance, or CDPA, allows eligible individuals who receive personal assistance services to recruit, hire, supervise, train, and change their worker as needed. The Southern Tier Independence Center in Broome County, also known as STIC, acts as the fiscal intermediary for CDPA services, coordinating the pay and benefits of personal assistants and billing for reimbursement for the hours that they work. And now I would like to introduce CDPA Program Director Sue Hoyt, who will share information about the consumer-directed program and the benefits of CDPA.
Hello, my name is Sue Hoyt. I am the CDPA Program Director for Southern Tier Independent Center, or STIC. STIC is one of several fiscal intermediaries in Broome County. The others will be listed in the video.
A fiscal intermediary is an organization that provides financial and administrative tasks on the behalf of the consumer. This allows the individual to focus on their quality of care with the peace of mind that their caregiver is receiving the proper compensation and benefits for their services.
Some of the questions we get at STIC in regards to this program may include, what do I have to do to hire a personal assistant through Consumer Directed? Each consumer is responsible for hiring their own personal assistant, or PA. They can hire anyone they choose, other than a spouse or a parent, if the consumer is under the age of 18. All personal assistants have to complete specific medical requirements before they can begin working. Each FI may have a different way to complete the process of hiring a PA. Another question we may get in regards to this program is, what is the fiscal intermediary's administrative role in the process of setting up Consumer Directed? The fiscal intermediary, or FI, completes an intake with each new consumer after receiving a referral for CDPA services. During this intake, the FI will explain the CDPA program. The FI also enrolls personal assistants so they may begin working for the consumer, and processes payroll and benefits for personal assistants. They also are responsible for maintaining consumer service documentation and records. Another question we may get about the program would be, how does a personal assistant get paid? Personal assistants are paid by the FI based on the hours they work for a consumer. Most FIs use electronic timekeeping systems to document hours of work. PAs are then paid for their work time according to the payroll schedule that has been set up by the FI. One of the questions that states a concern that people may have is, what if the personal assistant doesn't show up? Each consumer is responsible to make sure they have backup coverage for when a personal assistant may take time off, call in sick, or not show up for any other reason. If a consumer has multiple PAs, they can ask one of them to cover the hours. Consumers may also have a PA enroll with an FI just to provide that backup coverage, so they can be paid if they need to fill in. Sometimes backup coverage is provided by an unpaid, informal support, such as a neighbor, friend, or family member. Participants or consumers in the CDPA program get to do the following: choose their own personal assistant, hire as many personal assistants as needed within the number of approved hours, decide the tasks that are performed by personal assistants based upon their care plan, set the schedule that personal assistants will work based on their individual needs. A fiscal intermediary's responsibility in CDPA are issuing paychecks for personal assistants' authorized work hours, administer employment benefits for personal assistants, maintain copies of records, including nursing assessments, medical records, and employment documents, provide training to consumers, if requested, in areas such as how to recruit assistants, interview applicants, effectively train or supervise assistants, and more. CDPA consumer responsibilities are hiring, training, managing, and supervising the services of their personal assistants, informing the fiscal intermediary of any change in the status of the personal assistant, such as address, phone number, and employment status, complete required paperwork and ensure accurate timekeeping for all assistants, develop a backup system in case of absence of regular assistants. In order to receive CDPA services, a person must be assessed and approved for services by their agency funding source, local Department of Social Services or DSS, managed care company, or a grant through the local area agency on aging. All of these programs require assessments and reassessments for their continued support. Eligibility varies by program. Medicaid eligibility is required in order to be approved for services by DSS or a managed care company. This is not a requirement to be approved for services by an area agency on aging based on their program regulations. Medicare does not pay for consumer-directed care. Some of the benefits of using CDPA include: you have control over your own care. You can choose someone you are comfortable with to provide your care. At times, consumer-directed services can be implemented quickly. This can vary based on payer source assessment requirements. We hope that you have found this video informative. Please feel free to contact us should you have any questions in regards to consumer-directed services.
Contact the Southern Tier Independent Center at 607-724-2111. The Department of Health lists the following agencies as fiscal intermediaries that serve Broome County residents. Bird Home Health in Rochester, New York. They can be reached at 833-447-3326. Consumer Directed Choices out of Albany, New York. Their phone number is 518-464-0810. Freedom Care from Lake Success, New York. You can call them at 718-865-8371. Self-Direct Incorporated in Baldwinsville, New York. Their phone number is 315-635-5374. And Southern Tier Independent Center, based in Binghamton, New York. They can be reached at 607-724-2111.